Good afternoon, everyone. Thanks for joining us here today. I'm James Wood. I'm with Alberta Health Services Communications, and we're joined today by Dr. Franco Rizzuti, who is one of our Calgary Zone Medical Officers of Health. He's here to speak and provide an update on the E. coli outbreak that has affected some Calgary daycares. So just want to run through a few things very quickly. Just as you probably see, this is being recorded, and if there is anyone who will need a copy of it afterwards, we're happy to provide it. The format today is that Dr. Rizzuti will lead off with some opening comments, and then we will go to questions. Everyone is muted. Please indicate to me whether you are, if you're interested in asking a question, and you can either do that by putting up your hand or by indicating in the chat box that you have a question. And how it will work is that I will call on the person who's has the question. You will get one question and a follow-up. There are a lot of people on the call. I'm not sure if we will be able to get to everyone today, but we definitely will try to. And with that, I think that is everything. So I will now turn it over to Dr. Rizzuti. Thanks very much.
Good afternoon, and thank you for joining us. I want to provide for you today an update regarding our patients, about our ongoing investigation into this E. coli outbreak, and next steps as we head into the weekend. First of all, I'd like to provide some information about supports for families and patients who have tested positive in this outbreak. All of these patients are being contacted with information about how to access clinics Alberta Health Services has established for follow-up. There are multiple outpatient clinics in operation throughout the city to support this effort and to ensure that all those affected receive the care they need. If you are concerned about yourself or your children starting to develop symptoms, please call HealthLink or 811. If children do develop symptoms, including bloody diarrhea, please visit the emergency department. If your child is not symptomatic, please do not take them to the hospital. If you have concerns or questions, call HealthLink or get in touch with your family physician, and they will be able to give you the advice and support you need. We understand that this situation has had a significant emotional impact on those that are involved. We'd urge anyone who has been affected by this and needs support to call the mental health helpline, which is available 24/7 at 1-877-303-2642. As of today, we have a total of 142 laboratory confirmed cases connected to this outbreak and 26 hospitalizations, 25 at the Alberta Children's Hospital and 1 at the Peter Lougheed Centre. There have been 5 patients associated with this outbreak who have been discharged since the outbreak was declared. The majority of individuals who get sick from E. coli generally improve on their own and without specific treatment within 10 days, but a small proportion may develop more severe complications. Currently, 11 of those hospitalized children have more serious illness related to this outbreak, and our hospitals have the equipment required to establish patients receive the best care possible. A small number of patients are receiving peritoneal dialysis. However, this number is too small to provide for privacy reasons. At this time, all children on inpatient units are stable. Dialysis machines have been brought in from other Alberta Health Services sites, as well as rented, to ensure we have adequate capacity to care for patients now and in the coming days. We have also increased our supply of vital sign monitors and IV pumps. The Alberta Children's Hospital staff are working hard to ensure all patients are getting the care they need, with many staff working extra hours. We are extremely grateful for their dedication and support during this challenging time. We continue to work to find the source of this outbreak, but have not yet pinpointed it. Our staff have been working with the operator, all of which have been very cooperative in our investigation of these 11 facilities, which have been given these closure orders by our public health inspectors. In the meantime, since opening the outbreak, our public health team has used multiple measures to control this outbreak and protect the health and safety of children and staff. This began with the closure of the central kitchen at all daycares affected by this outbreak last weekend. Our expert staff have conducted inspections and food testing, along with providing extensive cleaning and sanitization direction for the central kitchen and all 11 affected daycare operations. We have worked with partners in primary care, emergency departments, and the pediatric hospital to ensure symptomatic children and staff receive timely and appropriate care. And we are ensuring that all children and staff who become ill as a result of this outbreak return to daycares only when they are no longer able to transmit the bacteria. With this in mind, I would like to provide you the plan moving forward for reopening of the affected daycare services so that parents and families can plan for next week. I want to stress that the health and safety of children and staff are our absolute top priority. Facilities will only reopen if we are confident that health and safety will not be affected. Currently, there are 11 facilities which have been issued closure orders last weekend. 4 of those sites have not had anyone reporting E. coli diagnoses or symptoms. These 4 sites include Fueling Brains Bridgeland, Little Oak Early Education, Almond Branch, and Brainier Academy. These 4 facilities may open Monday, September 11th, as long as there are no cases or kid staff reporting symptoms. No stool samples are required for attendees and staff at that site. The other 7 facilities where there have been affected children and staff have an additional exclusion order. The exclusion order means that these children and staff may not attend any childcare facility. These 7 facilities will be permitted to reopen Tuesday, September 12th. However, children and staff will require clearance from Alberta Health Services. We call this a rescind letter to attend this or any other childcare facility. And this is in order to prevent any further transmission of infection. Parents will be receiving phone calls and these orders starting on Monday morning. They will come either via HealthLink or our public health teams. These facilities include the Fueling Brains locations in Braeside, West 85th, New Brighton, Centennial, and McKnight. It also includes Vic Academy and Kids Space. I want to stress that these environmental public health processes are ones we follow for all outbreaks. No facility is allowed to reopen without our strict regulations being adhered to. And I really do want to reiterate that we only reopen a facility if we are confident that health and safety will not be affected. We will continue to keep families informed and equipped with guidance on which symptoms to monitor for and next steps. All of this information and more is available on our website, that is albertahealthservices.ca/E.coli, ahs.ca/E.coli for short. And we encourage parents to go to this site. It will continue to be updated over the weekend. Thank you, and I'd now be happy to speak to any questions you may have.
Thanks, Dr. Rizzuti. So I have a couple people who've indicated so far that they have questions. So we'll start with Jennifer from CBC, please.
Thanks for taking my question. Just a quick clarification, if I can. The 11 with serious illness, are those all diagnosed with HUS? And then I'll just follow up with my question.
The 11, from what I've been told, some do have HUS, but others have just more serious illness requiring more close monitoring, and I don't have any additional details past that.
Okay, thanks. I guess I'm wondering, I know you're bringing in, it sounds like equipment, dialysis machines. Can you just give us a sense of like how many of these machines you've brought in, if you think you're going to need them all, and you know how that compares to like your normal levels, and have you had to bring in staff as well?
With respect to the staff, we do have sufficient staff. So within the zone, we have enough physicians, nurses, and other allied healthcare teams to support this. Within the zone, we have moved around equipment, so additional dialysis machines, IV pump from some of the adult sites to children. And this is all out of an abundance of caution and just preparing that should we see any more serious illness, we have everything needed at the Alberta Children's Hospital. And I'd look to our Alberta Health Services comp team for any specific numbers on the equipment that's been moved.
Can I ask, what are you anticipating this weekend, given the timelines that we've seen with the exposure, symptoms arising, and that window? What are you anticipating in the coming days in terms of the peak of this outbreak, in terms of primary cases, and then children who may become more severely ill with AHS and potentially needing dialysis?
With respect to this outbreak, we continue to be working off the hypothesis that it is a central source linked to this kitchen. And with that, the rate that we've seen these new cases is what we would expect. It's in keeping with a point source, so single source of infection. And so we do anticipate that our case numbers will stabilize as we move into the weekend and next week. Our main focus with all of our stool testing and these rigorous measures we have in place is to monitor if we're seeing any secondary spread. I can say to date, we have not seen any cases linked to this outside of households of perhaps sick contacts. So we have not seen it in any other daycare facilities, other food handlers, other places in the community. So we're going to continue to focus on ensuring we don't have any more forward spread and continue to monitor our case counts. With respect to acute care and presentations, we really wanted to make sure that we have everything ready. We have teams at acute care and our public health teams continuing to work over the weekend should we see more cases present. But it's hard, it is difficult to say what the weekend will look like. But as I said, I do anticipate our case count will stabilize as we move forward.
Thanks, Jen. Next question is Adam from Global.
Yeah, thanks for taking my question. Wondering if you can speak to the added strain that this outbreak is putting on hospitals, especially the Alberta Children's Hospital.
I can say that the Alberta Children's Hospital has made miracles happen and have mobilized resources. They have a very dedicated group of clinicians, physicians, allied health nurses, and administrative leadership teams who have all come together to ensure that routine operations continues to be supported. I know our emergency department at the Children's has seen high volume. Last I understood, all children in the emergency departments are continuing to be seen. Routine practices, procedures are all continuing. And these additional clinics we have stood up are all in addition to baseline operations. So no impact to our routine functioning at the Children's, but making sure that these children who are affected by this outbreak do have the support they need.
And then a question about these additional clinics that you've stood up. I've heard that in addition to the Children's and Peter Lougheed, South Health is also helping. Do you have a list of where all of these clinics are that we can share with the public if parents are needing urgent attention that they haven't already sought?
So at this time, what we're asking is that anyone with new symptoms who have not previously accessed healthcare to go to an emergency department. So if they are positive, a positive E. coli diagnosis, or they present to an emergency department, they will be connected by AHS to these clinics, and we will be working to find the clinic that's closest to them to support the follow-up going forward. So parents who have access healthcare will be contacted by AHS to connect with these clinics, and any new symptoms we would ask please present to emerge, and we will ensure they're routed through that. I'll look to our AHS team to be able to provide information about the clinics as we can.
Thanks, Adam. We'll go to Kelly from the Globe and Mail, please.
Hi there. Can you hear me okay?
We can.
Okay, great. Thanks for taking my question. First off, are you able to say of those 142 cases, how many are actually primary cases of children who attended the daycares or were staff, versus how many are secondary infections that their family members might have caught?
I don't have that breakdown on hand. I can say the vast majority of these cases are primary cases, so staff or children at the daycare. We have seen a small amount of household infection, but I don't have that breakdown on hand.
Can I also ask, I've heard from some parents who are concerned about the amount of time they're having to sit in these clinics to get blood work. Some are having to sit there all day. They're also concerned about the time it's taking to get back negative tests that might allow them to return to daycare next week. What are you doing to try to address some of those wait times?
With respect to the lab element, so we have sent over 2,000 stool specimens out to families and then collected through the lab. We've increased lab capacity to a point to increase and support that. What we will have is, as I said, as of Monday, there will be, we're utilizing our HealthLink team and public health teams to make phone calls out. So parents will be having that rescind information they need to allow children to return next week, as long as they meet the criteria. It's important to say that our negative tests take a little bit more time to come back than positive. So if we have a positive test, we then will do some additional screening, but we're very confident in an early positive. We do, though, have to wait extra time that if we have a negative, to be confident that that is a true negative. And that's just the very nature of the assays and techniques we use in the lab to detect E. coli. So the negative tests, unfortunately, do take a little bit longer. We are running as fast as we can, increase the throughput in the lab to process all these specimens. With regards to the clinics and emergency departments, we've continued to increase capacity with all these follow-up clinics going into the weekend. And so our teams are working very thoroughly and thoughtfully to reduce the amount of wait time, and also make sure that parents can access a clinic close to their home. And I would look again to the AHS comms team if there's any additional information they can provide you offline.
Thanks very much.
Yeah, Kelly, if you're looking, I'm not sure how much more we might be able to add, but if there's more you're looking for, you can follow up with me. Next question is Colette from the Canadian Press.
Yeah, sorry if I missed this. I just was wondering if there's a breakdown on how many patients are children and how many are adults, or even a percentage of.
I don't have the breakdown of the 142 confirmed cases, children versus adults. Again, the vast majority of these are children, but I'd have to look offline and get the exact breakdown between the children and adults.
Presumably, the most severe cases are at children's hospitals, so they are children. Is that fair to say?
We have ensured that we have the right matching of age and supports. My understanding is that we have hospitalized pediatric patients, but they are at site based off of appropriateness for care and just to share the load across sites.
Okay. And then have you had to bring in staff from other parts of the province or elsewhere to help with this?
We have been able to manage the acute care elements with all of the staff within Calgary zone. So nurses and physicians in the front line are all pediatrically trained within Calgary zone. On the public health response, we operate in a provincial model. And so that has allowed us to shift workload amongst the provincial team in order to best support Calgary Zone.
Thank you.
Okay, well, I think that looks like that's it for questions. So I want to thank you all for coming today, and I want to thank, as always, Dr. Rizzuti and all the AHS medical teams that are working very, very hard on this issue. So thanks everyone.